want to welcome my dear friend, Dr. Deborah Kelly from next door, so to speak, a partner at Piedmont Internal Medicine. Today we're going to focus on hormonal balancing in women, particularly focusing on pre-menopause and post-menopause. It's important to all of us. I, as a dermatologist, talk about how it reflects on our bone structure, on skin, on elasticity. And that's why I love to have such collegiate, fantastic relationship with an internist that has great high interest in hormonal changes. We were both excited that we've timed this actually independent of the removal of the black box warning from the FDA. And I know this has been a lifelong interest for you, treating patients for so many years.
Well, it's such an exciting time for women's health and menopause hormone replacement therapy at this point. We just did go, my partners and I, to the Menopause Society meeting, which is a society meeting throughout the country with all the best experts and updating everyone and all the current recommendations. But all this is stemming from the FDA had a roundtable discussion of the 10 top experts in the country in July of 2025. And after that symposium is what spearheaded them to remove the black box warning date, which is super exciting.
Yes.
Because for 10 to 15 years after the 2002 Women's Health Initiative information came out, hormones were thought to be kryptonite. Stop treating women with it, and so there's a large group of women, there are 15 to 20 years, that were not adequately treated. But we now know, post hoc analysis of all that data from the Women's Health Initiative, that it really determines the age at onset where you start the hormone. The Women's Health Initiative was 65-year-old average. So they were 15 to 20, 25 years past menopause. So extrapolating that data to the true menopausal time is not accurate. So that is why they have looked at this data again and have removed the black spot warning. So now we know if you start hormones within the first 10 years of menopause or less than 60, you actually have reductions in cardiovascular disease, reductions in breast cancer, reductions in dementia, and reductions in osteoporosis. So the brain fog lifts, the vasomotor symptoms are treated, your bone health is better. And again, cardiovascular reduction in risk up to 60. Ages 60 to 70 or 10 to 20 years post-menopause, it's neutral. If you're greater than 20 years beyond menopause, that's not the population we really want to start hormones on, because those risks are there at a fraction, but are for the older patients over 70 or beyond 20 years of menopause. And there's a lot of options. There are also non-hormonal treatments for menopausal symptoms as well. But hormones are distinctly recommended for the genitourinary symptoms of menopause, which causes recurrent UTIs, can cause urosepsis in elderly patients. You can use vaginal estrogen every day the rest of your life. There's absolutely no absorption whatsoever. There's no risk with breast cancer. There's no endometrial cancer. There's no risk of dementia. So they've taken that warning off. And then we've reanalyzed, if you're doing hormones, using the estradiol patch along with progesterone is the safest way to go. So there's so much great data that's coming out that's really exciting, because we can help women. This is a time where they really do need help, and it's exciting. But if patient doesn't want to do hormones or there's contraindications, there are medications that we can use to target bone. There's also other medications for the genitourinary symptoms of menopause, which is the selective serotonin reuptake inhibitors or the serotonin norepinephrine reuptake inhibitors. So there are other options. And Veoza is another medicine that's newly available for only postmenopausal women, that if they have moderate to severe symptoms of vasomotor symptoms, it can be used.
I think that, the point that I've heard from you is that you come in for assessment first, right?
For
so
sure.
That's usually what happens, and that's based on blood work and a physical exam.
Correct.
And then depending where you are along the trajectory, depending on the age group, different recommendations will fit.
Correct.
So I get asked on our side, how is the delivery? You've mentioned a patch as the best. Are there other methods of hormonal delivery that could be of benefit?
Well, there's the oral one, but then you do have the increased risk of blood clots with that, whereas you do not with the patch, because it bypasses the liver. There's also the vaginal applications that are available as well. The most favored, if you're doing systemic hormones, is going to be the patch, along with progesterone, which is micronized progesterone. that is considered the safest. If you don't have a uterus, you can use estradiol alone, and that actually decreases your risk of breast cancer. And if you used estrogen and the micronized progesterone together, there is no change in the breast cancer mortality. So it's neutral. So that big scare is just not there.
Such great news. What about other options? You know, there are bioavailable hormone. Can you make a quick comment about different types?
Well, I will say social media this was all over the conference. It has given a lot of very misinformation to the public. And they are very against compounded formulations. They are not as safe as the prescription FDA approved medications. So the compounded, there's contaminant, there's higher risk, there's unknown standardization, and that is not recommended.
We could ask about testosterone. Is that important in pre-menopause, post-menopausal women? Is that of any benefit? And if so, how should that be delivered?
There's not a testosterone approved prescription for women. So hopefully that's coming with all of this. So what is done is the gel is actually use 1/10 of the dose of the man's dosing. But you do have to follow testosterone levels after initiating it, because you don't want virilizing features or high level.
And I know that a lot of patients have, you know, at least clinically reported benefits from different forms. So it's very important to hear what's officially recommended and what's been studied and of benefit. I know from our standpoint that the hair growth, the skin elasticity, the appropriate pigmentation, the recovery from surgical procedures or many of the laser treatments are very much benefited by appropriate hormonal balance. So I think if you're looking for kind of this general health benefits, we're so excited that we can help women in a very appropriate, beneficial manner that's safe for them.
And they've shown, also reanalyzing the data, there's a much lower all-case mortality for women that are all on hormones, again, within the first 10 and 20 years of the onset of the last menstrual period. So all-case mortality is lower.
That's amazing. So if you want to live longer, look better, be well, come see us together. And thank you for joining us. And thank you, Dr. Kelly.
Thank you so much. Thank you.